my name is Jamie Taylor, and today is January 23rd, 23, and I'm going to be doing the video over surface anatomy, and I do have this on the index card just so that I can make sure I'm saying in the video, in the video what is required. So I will have that I'm looking at. So the first thing I have is what's the importance of surface anatomy. And so the importance of surface anatomy is that you're able to relate external surface landmarks to location of some internal organs. So that will help, especially if you come up on an emergency situation and to assess things, knowing the surface anatomy and maybe what's happening with some of the organs or some injuries. Show at least 5 external structures that can be observed on the body surface of a model. So I have voluntold my daughter, so thank you, Kenna. She is going to be my model. So come over here. We'll start out here. We have the back. We have the occipital area. Here we have the temporal, which of the it's part of the skeletal system on the outside part, protecting, but inside it's basically protecting those areas that we know are part of the central nervous system, the temporal lobe and the occipital lobe. Here's her zygomatic arch. That would be part of the skeletal system. Another part of the skeletal system, her patella. Thank you. Patella's right here. It's also part of the skeletal system. Thank you. Right here is her thyroid cartilage. We kind of think of it as our thyroid cartilage. We think of it as our Adam's apple. It's be more prominent in guys. But down a little bit lower to that is the cricoid cartilage. They're part of the musculoskeletal system. Let's pull her. Thank you. Sorry. The biceps, she just got back from the gym, so her biceps brachii, the muscular system, hopefully is getting a little bit stronger.
I don't even hit nickels.
Right here would be the median cuboidal vein, and that would be part of your cardiovascular system. Let's see. Mention a clinical application of a couple of the structures. So for the thyroid cartilage is up here, and the cricoid cartilage. The thyroid cartilage right here is the superior carotid cartilage. The SCT region is in the anterior cervical division, and that is a lot of times used to palpate and feel a pulse. Wait, let me show you live.
That's a good one to do.
Feel a pulse, yeah. So you can get the heart rate and see. So a lot of times that's one use of that application. Another one would be the median cuboidal vein right here. Well, a lot of times this is a common site for obtaining a venous blood sample, so this is a lot of times utilized for that, and that's another application of the surface anatomy. Thank you. Thank you, Kenna.
I'm done.
Yes.